One thing that I think I had a few questions that's why I brought you on. I had a few of the other, every one of my doctors that I have brought on, they're all fantastic at what they do. What Dr. Simovitch, I wanted you to explain a little bit the difference between a total shoulder replacement and a reverse total shoulder replacement. What you look for, how you decide which one to do. I had a question, and I kind of was putting it in layman's terms on how I see it. Just in general, I would see it as a reverse total shoulder is when the rotator cuff is completely obliterated, but there's other ways. I'm sure that you're how do you evaluate that?
Yeah, so my evaluation's probably changed. So my evaluation hasn't changed, my indications probably have over the years. So when I look at patients, there are kind of two buckets of patients. There's those patients that have shoulder arthritis, but their rotator cuff is intact, and those patients that may or may not have shoulder arthritis, but their rotator cuff is not intact. And so if a patient generally and historically had shoulder arthritis where they're wearing away the cartilage and more or less bone on bone, but their cuff is intact, historically and even now, I'll still mostly do a regular anatomic replacement, regular total shoulder replacement. But if someone comes in and their cuff is deficient and they have arthritis, or they just have chronic cuff problems and it's not repairable through other means, then I'll do a reverse shoulder replacement. And then to get a little bit more nuanced, if someone has significant bone wear, potentially I'm seeing them for a revision surgery. They have very limited function. Those are reasons why, even if the rotator cuff is intact, but they have arthritis, that I might do a reverse and not an anatomic or regular total shoulder replacement.